unfortunately, medicine is still taught to deal with emergencies, traumas, infections, hands-on trying to keep people alive. But now we're in the era where we're not just keeping people alive, but, they're living their lives. We're dealing with chronic neurologic progressive disease, which we never thought that was going to be possible. But, here are patients, they're having to deal with this disease. And doctors, sometimes we don't have the tools to really know or understand what is really vital or crucial for patients on a daily life. We're good at keeping them alive. We're good at, preventing falls and keeping them from the hospital, aspiration pneumonia. But then how do you deal with the nuances of everyday life? And I think that's where we're trying to change the perspective, to realize that sometimes it's not the big things, but the little things that really cause the quality of life to not be so good. And so I think that emerging doctors, especially newly trained physicians, to really understand what it takes to deal with a chronically ill patient, not only chronically ill, but one that is progressing, not only aging, but progressing. And so I think that that's why this is very important. Until you kind of get a taste, until you're the patient and live with, how it feels like to be stuck on the ground and not be able to move, to not be able to put your keys in the door or break an egg without making, a 20,000 little shells in there. I think that that's why it was really good to offer that experience so that they get a taste of what it's like to have trouble talking or walking or eating, how difficult it is to eat or how slow it is and how they get malnourished because they're so slow. And so they can get a little insight, a little window into what life is like living with these diseases, but also to realize that not only at any given time are they dealing with the specific, trouble walking, trouble eating, but as we age and the disease progresses, all those start accumulating and they get worse. And so, trying to put all of that conglomeration of things, trying to keep them so they're safe, but also to still maintain their dignity and quality of life. And so they can start thinking about, it's not just did you fall, but, were you able to, do your dishes? Were you able to shower? Were you able to, that kind of thing. So we want to create an ambience where we still remember to be humans, to listen. And sometimes we don't have the answers as doctors, and we know that very many times we don't have all the solutions. But sometimes just listening, sometimes just being there to offer a kind word or to give a hug or to touch somebody, that is all that patients need, because we know that is a complex disease. And because it is a complex disease, although there's a conglomeration of symptoms, and everybody has 10, 15 symptoms at a time, at any given time it's very specific to what they're dealing with. They may be having more trouble swallowing or chewing or walking, or so then we have to really listen and see what is important at that particular time for that patient, and try to tailor our symptom treatment to try to improve what they're dealing with, not just blanket, okay, let's treat all those, symptoms, because although they may be having a lot of tremors, they may be able to manage what they're having with, but having a lot of trouble going out to eat or socializing because they have the stigma, or because, they've taken so long to eat. And so now they're being more secluded. And so that leads to isolation. So that's where the individual treatment and understanding what's going on with the disease and the symptoms, how everybody's coming from a different direction, to try to really try to put ourselves, and it's hard if you've never had an illness, as a doctor, as best as you can. It's happened to me. I thought I was very good at dealing with Parkinson's, but until you live with it, you realize the nuances, and you realize that sometimes it's more the little things, like for me, taking off my makeup or putting on my makeup or putting on my earrings, what's a lot harder and more difficult than being slow or being stiff, or, it's like, can I please put on my, get dressed? And so sometimes, things that doctors may not think about, because that's not really, we're trying to keep people alive. That's not important in our, medical training. but to a patient, it can make a huge difference. And so we really have to listen and say, what is going on? What is bothering you the most? What is, your social status? And it's different from whether you're working or not working, whether you're retired or not, whether you're young or old, whether you have 10 kids at home, so your treatment varies depending on that, because your energy, your requirements for being well or being, on are very, very different. So I think that that's why I think that things like this are very, very important. And I hope that it starts to bring awareness, and not just for Parkinson's, but all the neurodegenerative diseases and all the neurological diseases to really start listening and tailoring, treatment.